One of the most common discussions I have with families in the first year of life is around concerns about autism, and rightly so. I think that anybody who is a parent or is thinking about becoming a parent has certainly been exposed and been reading about the idea that we have been experiencing a clearly definable rise in rates of autism over the last generation. Currently, those statistics are measured at about 1 in every 68 children. And the major open question is why? And I think it's reasonable to have an open and candid discussion about what those things seem to be and where the research is going and what people are looking at. So first is, I think people need to be clear on what is autism. Autism is not diagnosed with any specific imaging study or biologic marker, although I think those are coming. I think that soon it'll be really in the realm of functional MRI or some other advanced imaging that allows us to diagnose autism at a much younger age. But it is defined by sets of behaviors that affect the development of normal social interaction and reciprocal social behavior in relationships, as well as a clearly increasing sort of rigid, defined set of behaviors and restricted interests that seem to evolve and emerge as a child ages. However, there is what's called a regressive form of autism, where some children appear developmentally normal through the first year, and then rapidly decline and regress into autistic symptoms after the first year. So, and the one thing that's clear is that there are multiple causes that seem to occur in diverse combinations, and it's what's become clear in the research that's available is that there is a definite genetic and environmental combination of factors that seem to lead to or trigger autistic symptoms. Most of the studies and most of the research that we understand clearly points to insults and issues that occur prenatally. And more specifically, I think what's in assessing the long-term studies, especially in twins, is that there's no clear set of proportions that we can assign to how much is genetic and how much is environmental. And there may be even a more complex interaction, whereas certain environmental insults will trigger autism only in specifically genetically predisposed people. And you combine that with the fact that we have also a broader understanding of autism, much more so than a generation ago. So we define it much differently, so it includes way more people. There is much more access to healthcare. So more people that we probably didn't recognize or even entered the system as being diagnosed are now diagnosed. And all of these factors have clearly led to what we now understand is a rise in the identification of autistic children. So there is, I think, the elephant in the room, and I think the thing that needs to come out and be candidly talked about is, are vaccines part of that environmental trigger? So where did that idea really come from is the fact that we recognize that there is a form of autism that's regressive, that shows up after the first year. And of course, we start vaccinating children at 2, 4, and 6 months, combined with a clearly debunked, falsified study from a British physician, Andrew Wakefield, who erroneously and falsely assigned MMR, which is a vaccine usually given around 12 months, as a cause for regressive autism. There have been numerous studies from all parts of the world that have clearly and definitively removed this idea that of all the environmental insults that we can talk about that occur to children prenatally and postnatally, it doesn't seem to be vaccines that are part of that picture that trigger autistic symptoms, especially vaccines occurring at 12 months of age, specifically the MMR vaccine. There are a host of other environmental factors that we have noticed they're increasing in our environment that can all be related to this. Maternal infections, certain medicines used prenatally and postnatally, specifically antidepressants, certain antidepressants, maternal psychiatric conditions, general increase in obesity rates among the entire population, which confers, poor metabolic health, environmental toxins and in our environment, in our food sources and in our air, all might have some contribution. So I think that all pediatricians, have clearly acknowledged the fact that this is an increasing problem, that it's something that we all know is more prevalent. There are multiple complex reasons why that's the case that all interact with one another. And I think having an open, candid discussion with your pediatrician about your concerns and about autism, I think all of us are ready for that, and all pediatricians are interested in having that discussion and want to help all parents understand what are the complexities genetically, environmentally around autism and why we're seeing it more than we ever have. I hope this helps.